Hi, I'm Luke, and yesterday I finally had my top surgery consultation with Mr Antony Fitton. I was so excited. The day couldn't have gone any better. He's just an incredible surgeon, and I just cannot wait for my top surgery now. So I will be going to see Mr Antony Fitton down in the Plymouth Nuffield Hospital. It's a bit of a drive for me. That's like 4 hours away-ish, but to see Mr Fitton is worth it. My consultation with him was absolutely fantastic. It wasn't stressful at all. He was really thorough. He was really easy to talk to. Like, it just couldn't have gone better. The consultation started with him asking me like really simple questions, just like my name, date of birth, what my occupation was. As soon as I said that I was a uni student, he then started talking to me about that. And then he started to talk about more serious things. So he was asking about my transition. He wanted to know how I'd gotten to the place I was already, how my journey had been so far to get to him, when did I start to realise that I was trans, all stuff like that. Not for a reason to be like judgmental, are you ready for surgery, are you not? But I feel like it was just to understand who I was and where I was actually up to. He decided to get the worst part of the consultation out of the way first, which I was very happy with. So he then took me into another bit of the room to do the examination of my chest. I was obviously dreading this, but it really didn't go as bad as I was expecting at all. He was so quick, really polite. He spoke to me about my uni course the whole time to distract me. It was just over in seconds. He dealt with it in an amazing way, and it really put me at ease. All that bit of the consultation consisted of was him taking a simple photo straight on, that was it, and then just measuring from the top of my shoulder down to my nipple, and not once did he touch my chest, like anything like that. It was just a photo and the measurements. He then started to work through a checklist that he had of key points that were needed to be discussed, and this made up essentially the whole of the appointment, I would say, the main bulk of it anyway. He started out by actually drawing out what he would be doing during surgery, so he knew that I fully understood what was going to be happening. He then went on to talk about like how he actually chooses where your nipples are placed, which I found really interesting actually. He explained how he bases it off of the form of a cis man's chest, but also takes your own measurements into account so that they would be in the place where your body would have them naturally, if that makes any sense. And again, he was drawing this out as he was walking me through it, so I completely understood what he was saying. There was not a bit during the consultation where I felt confused at all. He then started to talk about the risks and complications that were possible, and then even going in depth with why they happen and how they're fixed, which really made me feel better because I actually understood the possibility of them 100%, and I felt safe in knowing what they would do if a problem came up. He touched on dog ears being a possibility as a result of the surgery, and that may need to be resolved later on with a revision, but that obviously isn't for everyone, and that you just need to wait and see. One thing that made me feel really confident in going with Mr Fitton is that at the consultation, he was very proud of the fact that he has never lost a nipple and that he has done quite a significant amount of top surgeries. And he was also saying that he can't remember the last time he had someone who developed a seroma, and that he has never had an issue with symmetry whatsoever because he is so precise and desperate to get it right that has never been an issue of his. Another thing I really liked about Mr Fitton is that he is very up to date with modern techniques and trying new things to develop his surgery and making sure that his patients get the best results and that they're as happy as possible. Something that he's recently tried with his surgeries is administering a blood clotting medication during surgery to reduce the risk of a hematoma, and also puts, I think it's a spray version, on your scars so it protects it there as well. He's been using it for about 6 months now, and he has seen such a significant drop in patients developing hematomas after surgery. It really excited me that he does these new techniques to really try and get the best results possible, and I'm very excited to have that new technique used on my own surgery. He then went on to show me results from his previous patients, and they were exactly what I was looking for. At this point, I then kind of mentioned a couple of the things that were really important for me in my own results, and he really reassured me that that is what he would actually aim to do anyway, and that my body is perfect to be able to achieve those results. So I was very happy to hear that what I wanted was actually possible. Then he just walked me through what to expect on the day of surgery and a couple of things to expect post-op, like the scar care and possible post-op depression, all of that sort of thing. So there's no surprises for me at any stage of this operation. That was really it for my consultation with Mr Fitton. I think I was actually only in the room with him for about half an hour, but he explained everything so thoroughly and clearly that there was no need for it to be any longer. There was not a single thing that I left thinking, oh, what about this? Or I'm slightly confused about that. But Mr Fitton is just absolutely amazing. He is everything I had hoped for in my surgeon, and I just couldn't be happier with going to him. He had a great sense of humour and he was really easy to talk to. I have quite severe anxiety among other things, and he really put me at ease, and I felt comfortable being around him and asking him things and just genuinely talking to him. And knowing that I had mental health conditions and things, he really did put loads of effort into trying to make me feel safe and at ease. He would constantly reassure me during the appointment that I now have him and the rest of the hospital team there to support me throughout the whole of this experience. I just couldn't say anything better about the whole experience and him as a surgeon. But that was not the end of my appointments. I then had a pre-op assessment with one of the nursing team. She again started by asking the easy questions like name, date of birth, GP surgery, all of that. About half of the appointment was made up from her asking me questions about just my health in general. This was just to make sure that there was nothing that could possibly impact my surgery or my recovery. She didn't rush any of the questions that she asked me and really gave me enough time to talk about absolutely anything I was worried about. She even gave me time to talk about the things that were worrying me that wouldn't directly impact my surgery, and actually ended up giving me advice on certain things as to how I can go about dealing with them. And then I had to have some tests done. Yay! Nothing bad whatsoever. It was just height, weight, blood pressure, heart rate, and a heart trace. I think that was it. And then I was given this wonderful little book. It just has information on what to expect in general about surgeries. It's not specific to top surgery. It's just about medication, recovery, anaesthetic. Although she also did email me information on anaesthetic in a lot more detail and made sure I had to read it. There's also this little booklet in it. Not a booklet. It's a bag where you basically just put your medication in when you get admitted. Nothing special. And then at the back of the book, which is important for your recovery, they will, I don't know if you can see that. You can't see that at all. Yeah, just a load of information that they will fill out in regards to your recovery, so you know what you are doing. And I absolutely have to bring that with me on my day of surgery because I wouldn't have the stuff to put my tablets in otherwise, all the information at the back. So don't forget the book. I need someone to make a mental note for that for me. And then the final part of my pre-op assessment was to just go and see the phlebotomy team to have a simple blood test so they know that everything is okay. I think overall my pre-op assessment with the nurses lasted about an hour and a half-ish. But that's just because I had so many things to tell her. But overall, my top surgery consultation honestly couldn't have gone any better. As I'm sure I've said already, I'm just really glad that I've gone to Mr Fitton. I couldn't have chosen someone better for me. And it's not even just Mr Fitton. As incredible as he is, the rest of the hospital team are equally as amazing. As I was just sitting in the waiting room, the nurses had already spoken to me a couple of times. They remembered my name. Any time a single person would walk past you, they would ask if you're alright. They would say hello. It was just such a friendly place. Everyone I saw just had a really good sense of humour, and they were just so caring and passionate about what they did. It really made me feel at ease and safe in their hands at the end of the day. I've never had anything worse than a broken leg before that needed to be put in a cast, so the idea of surgery is absolutely petrifying to me. And my anxiety was going through the roof because of how close it is now. But I just feel so ready for it now and so excited after seeing them all. That anxiety is going and I just cannot wait for the end of the month. So yes, the Plymouth team are beyond amazing, I must admit. And yeah, I will update you on how my surgery went. And along with my Instagram and blog links being below, I will also put all the information you need for Mr Fitton and his team in Plymouth in the information box, so you can access that. And leave any questions you have below if you need. So see you later.